healthcare in children. The world through a baby's eyes is quite different from an adult's view. Newly born infants do not acquire normal eyesight congenitally. Rather, it develops incrementally as images are imprinted on the retina. Newborn babies are only able to see things within 20 centimeters. Therefore, babies see indistinct images of toys or parents when they appear in front of them. Furthermore, it seems that they are far more interested in lighting, simple images, and objects in motion. At 4 months, an infant will have developed some sense of depth perception. Typically, a 6-month-old infant's eyesight value is 0.1/2200, and he or she is capable of following objects with both eyes and adjusting his or her posture to focus on an object. During this stage of development, parents can check their children's eyesight by playing hide and seek or gently tossing balls. By the age of 1, infants begin taking their first steps and gradually acquire eyesight good enough to see objects around them. At the age of 2, parents can enhance a child's hand-eye coordination by playing with a variety of toys such as blocks, puzzles, clay, and percussion instruments. At the age of 3, children are capable of browsing through drawing books and discerning the shape and direction of patterns. This is the right time to examine their eyesight for the first time. At the age of 5 or 6, the children typically have achieved the normal 1.0/20/20 eyesight value. They can see clearly and stably. Remember, eyesight development occurs in steps according to one's age. Make sure children have their eyes examined at the age of 3. At the age of 3 to 4, children acquire the ability to recognize pictures. It is also the best time to do an initial eyesight exam to see whether they are developing normally. In order to protect a child's eyesight, the Department of Health of the Executive Yuan in Taiwan has created a special videotape that explains the standard procedures for eyesight checkups for preschool children. The videotape serves as reference and also helps promote child eyesight protection tasks nationwide among teachers in kindergartens or nursery schools, as well as child nursing and public health personnel. Through this videotape, not only can eyesight health care be put into practice thoroughly, but it will also empower teachers with the tools they need to detect children's eyesight problems early, before these problems become incurable. Currently, the most common methods for examining children's eyesight are the standard vision chart and the NTU random dot stereogram. In Taiwan, lazy eyes, strabismus and/or amblyopia, nearsightedness or farsightedness, ametropia, and other vision problems are increasingly affecting our children, and standards for childhood eyesight checkups have been put into practice to protect the eyes of Taiwan's youths. Introduction to vision charts. There are 2 types of standard eyesight charts. One uses the letter C of Landolt, and the other the letter E of Snellen. The respective distances between these 2 charts and the examinee are different. When using the C chart, the distance is 5 meters. For the E chart, the distance is 20 feet or 6 meters. The examiner should make a distinct mark on the ground so that the examinee knows where to stand. The chart should be placed so that the 0.9 to 1.0 target lines of the chart are at the same height as the examinee's eyes. What's more, the lighting on the chart should be approximately 500 to 700 lux or meter candles. Indoor lighting must be sufficient. However, take care that it does not shine directly on the examinee's field of vision. When everything is ready, tell the examinee to cover one eye with the occluder. Opaque cardboard will do, or even the examinee's bare hand is okay. Do not reuse the blinder, as this increases the possibility of spreading contagious eye diseases. Make sure they do not peek and use the supposedly covered eye. If the examinee wears glasses, his or her naked eyesight should be tested first, and their eyesight with the glasses on. When testing the eyesight, test the right eye first and then the left, pointing to the largest letter, meaning 0.1 or 2200 visual acuity, and then moving from the top to the bottom along the same column until the examinee cannot recognize the direction of the breach of the letter. Move to the upper row of the next column. If the examinee still cannot see clearly, move to the upper row. If he or she can recognize this letter, move down to the next lower row. By doing this back and forth several times, you can locate the examinee's eyesight value. But what is the correct value remains a question. There is a principle. One's eyesight value is the value at which the examinee can recognize more than half of the number of letters of that row. For example, if the examinee recognizes all the letters in the 0.6 row correctly, but only 3 are correct among 0.7 and 2 among 0.8, his or her eyesight value should be 0.7. The examiner should take a child's maturity into account, so different age groups have different standard eyesight values. For example, a child at the age of 4 is expected to have an eyesight power of 0.6, at the age of 5, 0.7, and at the age of 6, 0.8. Failure to meet their standard value may result from their clumsy expression rather than poor eyesight. Therefore, the examiner has to be patient by explaining the process clearly and allowing examinees to practice. Some children may not understand the concepts involved when it comes to recognizing the oblique direction of the breach in the letter C. In such cases, the examiner should use the chart with the letter E. If the examinee still fails, even though all conditions have been taken into account, he or she may have eyesight problems. The NTU Random Dot Stereogram, RDS. The depth perception checkup, or stereopsis, is also important. This test determines whether both eyes function well simultaneously and is invaluable even if the examinee peeks while doing the C or E chart examination. The NTU RDS test utilizes 5 cards and a pair of blue or red plain spectacles. On the back of the first card are 4 pictures which portray the other 4 cards' pictures. One side of the other 4 cards has a picture that can be recognized. The other side is the same picture hidden in disordered dots and is unrecognizable until the examinee puts on the blue or red glasses. When performing this test, it is important to use strong lighting. The picture should be placed directly under a bright light source, such as a desk lamp. However, there should be no reflection on the cards, nor should there be any backlight penetration or other lighting effects which would hinder or enhance the examinee's performance. The examiner should first teach the child to recognize and correctly point to the normal pictures with naked eyes, and then ask them to put on the blue or red glasses and hold the RDS cards at 30 to 35 centimeters distance. If the examinee is already bespectacled, the blue or red glasses can be put on directly over the spectacles. Choose the cards at random and hold them according to the directions on the back. Adjust the angle and make sure there is sufficient time for the examinee to see it clearly and describe what he or she sees. Examinees can hold the card by themselves to adjust the distance and angle. Reshuffle the cards before moving on to the next card to prevent them from guessing the pictures. An examinee passes the test if he or she is able to correctly identify 5 sequential pictures. Sometimes the examinees cannot express themselves properly and appear to fail to recognize the picture. Should this occur, the examiners should go back to the first card on which all 4 pictures are portrayed. Teach them how to identify and match the pictures and then test them again. If, after repeated attempts interspersed with an explanation of the test requirements and procedures, the examinee still fails to correctly identify 5 sequential pictures, it is probably an eyesight problem rather than a problem of expression. If the examinee fails the test, the same test procedure should be performed a few days later. If the examinee still fails, teachers have to fill out the referral sheet and notify their parents, and ask them to take the children to be examined by an ophthalmologist. Even if an examinee's eyes function well, they should still be examined by an ophthalmologist every year. Make sure you understand how eye examination charts work. Be patient when teaching children how to recognize the pictures and try to discern accurately the types of eye problems they might have.
吴医师好。
你们好，请坐。谢谢。你好可爱哦。
谢谢。
小朋友有什么问题吗？
最近我发现小朋友在看东西的时候，他的脸总是靠得特别近，我担心他的视力不知道是不是有什么问题耶。
好，我检查看看。从外观看起来大致是没有什么问题了哈。不过有时候幼儿视力的问题不一定从外观可以看得出来，必须要经过一定程序的详细检查才能发现问题。
那想请教一下吴医师，小朋友的视力问题有哪一些呢？
在视力发展的阶段，若是因为任何原因使得视网膜没有办法获得清晰的影像，这时候视力的发育就会受到阻碍，就造成所谓的弱视。那这些原因包括斜视啊、高度屈光异常啊、两眼不等视啊，以及视线被阻断这几个状况。那斜视就是我们两眼的视线不一致的时候，那譬如说内斜啊，这个是我们俗称的斗鸡眼嘛哈，或者是外斜啊，还是上下斜这些情形。那高度屈光异常，也就是指的高度近视，或者是高度远视，或者是高度散光等等这些情况。那我们讲的双眼不等视，指的是两眼的度数差异过大。那视线被阻断的话，指的可能是譬如说先天性的白内障啊，或者是眼皮下垂啊，还是角膜混浊这些情形。
原来幼儿视力的发展有这么多问题要注意啊。
对啊。来，我先帮小朋友做个检查。经过刚才的检测，小宁的视力和立体感还算正常。
可是吴医师，为什么小宁他在看书的时候脸都靠得特别近呢？
我们发现小朋友看东西太近的时候首先你要注意看看光线有没有充足啊，那不要让他看太细小的文字啊、图案啊，那要随时纠正他的阅读的姿势，要保持至少35公分以上的距离哦。那有时候就算小朋友的视力正常，如果他养成错误的习惯，或者是长期处于光线不良的这个环境当中，久而久之会影响到他的视力。那充足的睡眠和规律的作息，多注意一下营养的均衡，要摄取丰富的维生素哦。那并且要常常让小朋友要接触大自然，多看看远山啊、绿树啊，这些对幼儿视力都非常有帮助的。
如果检测出小朋友的视力有问题，要如何做治疗呢？
幼童视力最重要的问题就是斜视和弱视。大部分的弱视患童，如果是在视觉神经系统成熟之前，给他适当的治疗，大多数是可以矫治的。那到眼科做好详细的检查之后，依照医师给的处方，佩戴眼镜来矫正。如果单眼弱视，就还要加上遮眼治疗，目的就是要强迫小朋友使用视力较弱的那只眼睛。 如果弱视很严重的话，那也可以给他一些弱视训练。那对于有一些比较严重的斜视，就必须要借着开刀来矫治它的外观。
原来幼儿视力的保健还真是马虎虎的。
是的，不过你们做得非常的好。在幼儿视力的成长过程中，如果发现小朋友有任何的问题，就应该随时请教专业的医生，千万不能因为工作太忙就忽略了幼儿视力的保健。记住哦，要随时注意小宁的反应，更别忘了要定期为小朋友做视力检测。如果有任何疑问，要马上回诊哦。
谢谢吴医师为我们做这么详尽的说明。
这是应该的。小宁你好幸福哦，有这么爱你的爸爸妈妈。
Do you know what kinds of defects could occur in their eyes? Early detection and proper treatment increases the odds that defects can be cured. Remember to provide children with sufficiently lit surroundings and teach them good reading habits so that they do not develop eye problems. The eyes are the windows to the soul. We recognize things and learn about the world through our eyes. Eye problems can affect a child's cognitive and behavioral development. Age 6 is a critical phase in early development. Most crossed eye cases and other causes of poor vision, found before or by this stage, can be effectively treated. But it is easy for these seemingly minor cross-eye problems or single weak eye problems to go undetected. They can, however, lead to serious problems. Take children to the clinic for further examination if the following occurs. An infant cannot target nearby moving objects properly with their eyes. If a child or infant suffers from photophobia and aversion to light, excessive tears, constant blinking, or red eyes, the pupil appears white or yellow in the dark. The eyes are sensitive to light and one eyeball moves irregularly inward or outward. When focusing on objects, they have to slant their head at an angle. A child covers one eye when focusing on objects. A child cannot locate the correct line or row when reading or cannot write properly and correctly after schooling. A child feels stressed, nervous, or irritated after performing tasks that require sustained visual concentration. When looking at a distant object or blackboard, a child needs to close his eyes or her eyes for a few seconds or needs to look at others' notes listed on the blackboard. A child has the habit of rubbing his or her eyes or frowning after straining their eyes. A child often feels sick or contracts headaches, but no medical reason is found. A child exhibits a significant degree of absent-minded behavior, daydreams excessively, is clumsy, or has poor hand-eye coordination. A child has frequent headaches, especially in regions around the eyes. A child reads books using improper postures, too close, too far away, or at a particular angle. By paying more attention to these details, parents can detect their children's eye problems before they become incurable. Early prevention and proper and continuous treatment is the best cure, with successful cure rates of up to 80 or 90%. But remember, the age of 6 is a crucial point, after which the effectiveness of treatment diminishes. Well-functioning eyes are key to the proper development of the whole child.
Yeah!